You guys have your mic down there, so you'll just pass that up and down. Okay. Okay. All right. Thank you.
Good morning, everybody. Good morning. Good morning. I'm Deb Dingus, Executive Director for United Way, and I want to welcome you to our monthly Community Partner Council forums. The purpose of our forums is to bring people together, to convene us, to get us out of our silos and our areas, to see a lot of cross collaboration and partnership, opportunity to build relationships. But the other purpose of these forums is to provide advocacy and education around some of the topics that are the most important as it relates to the health and well-being of the Wisconsin County. The topics that are chosen by a committee of folks that work with United Way. They volunteer along with some of our staff. And the topics align with the priorities that United Way and the community have collaboratively come together and said, these are the issues that we want to focus on. Advocacy and education is very important. The more we learn, the more that we raise our voices, the more that we can impact policies, changes locally, regionally, statewide, and nationwide around really important issues. I've not been able to be with you for the last few months. United Way is also really busy doing a variety of other things beyond educating and convening and doing advocacy. We raise funds and we award dollars to not-for-profit programs, as well as work on sponsoring and being engaged in the issues that are the most important to us. We have one of our panelists who is on their way, John Jordan. Maybe some of you know him as the Executive Director for the Licking County Alcohol Prevention Program. He is on his way. And I'm just going to make a few announcements maybe to start with rather than end with, so that we can give him a minute. I want to introduce to you, in case you haven't met some of our staff. I think all of you have already met Corey. Corey, hopefully those of you who applied for the program have all had the wonderful opportunity to meet Corey and talk about your programs. And he oversees that process of a lot of volunteers. Our awards, the funding awards that we give out, are very thoughtfully done. We don't just take in money and give it out. We really look at aligning programs that align with the most important issues in Licking County. We really do try to take a very high view and look at the not-for-profit ecosystem, which we need throughout Licking County to make long-lasting changes in people's lives. So those panel experts, those volunteers, they do a good job of looking at governing documents, financials, outcome measurements, all of those things that go into making a really successful program so that we're most likely to have long-lasting changes in our community. So I want to thank Corey Stutes for heading that up for us, and thank you, Corey. He's also the person who's been helping getting our team together with the Community Impact or the Community Partner Council forums together. So thank Corey again. Give him a round. And then I want to introduce to you back there, she's taking some pictures, Ashley Van Ness, who is our marketing director. And she's the one who's responsible for taking pictures. We've also had a request throughout our community and our region now to tape these forums. So we have two available right now on our website. One's audio only, and that was the one on transportation. And then the one from last month on the important role that harm reduction plays in addressing addiction is also, I don't know what you call video stream. I said in my board, videotape, nobody uses that word tape anymore, right? So stream, we're hoping to move forward and have these live streams available as well. Take those. You can download those, you can share those out, use those as educational opportunities in your not-for-profit sector within your spheres of influence, you know, this is what this is about. All of us have got to continually raise our voices collectively together to get changes going in our community. So thank you, Ashley, for doing that. And then finally, we have a new staff member on board I want to introduce you to. Back there, wave your hand. This is Andrea Rawl, and she is our new development director. So all of you who are out there running campaigns and are involved in raising funds so we get more money and more programs, that's the ultimate responsibility of the United Way, is to increase services. And I should say we don't just do that through the funds. Again, it's through advocacy and it's through volunteerism that we build capacity. But Andrea's job will be to increase the funds that we raise into our community so that we can help all of you continue to do what you do in our community. So if you've got any questions, please reach out to Andrea. She would love to get to know you and meet you. And we're so glad that she's a part of our staff as well. Our board member back there, Ashley Washburn, raise your hand. I think all of you know, she is elected on behalf of all of our funded partners as our CPC rep to the United Way Board of Directors, and is also very instrumental in helping these forums come together. So again, thank you for being here. Corey, I think, had an announcement about a forum coming up in February. Did you want to say a word about that? Because we're going to go do announcements. We're going to delay as long as we can.
All right, morning everyone. Thank you. I just wanted to quickly give an update on something I had mentioned a month or two ago. We're getting closer to the point in actually starting to register folks for this, but coming up in February, mark your calendars, February 14th, easy date to remember, we will be having the very first Community Partners Council Nonprofit Expo. So we're very excited to have some confirmed details on that. It will be in the morning through lunch, about 9 to 1, and it'll actually be happening here. So we are going to have this entire back space open. There will be plenty of room for our funded partners, for nonprofit organizations. We would like to include public sector organizations. It's really open to any nonprofit in any capacity who would like to attend. Of course, space will be limited. We would like to have everyone available, but we should still have plenty. So mark your calendars for that. Emails will start going out to for people to reserve their booths. So be on the lookout for those. We'll be hopefully filling up the I don't know what you would call it, the roster, I guess, of participants in September and October, because then we want to start publicly advertising in November. So be on the lookout for that. It's something that's very exciting. We've heard so many conversations in meetings here at these forums, out just meeting with folks that sometimes it's so difficult, even just for those of us that work at nonprofits, to know what other agencies are doing, what services they have, who is where, who's working at the Tascala, if you're focused on work, it can be difficult. So this is an opportunity for us to learn about each other, an opportunity for us to engage with the public who may be looking to volunteer, who may be looking for jobs, who may be looking to donate. So it's going to be a really, really good time. We're looking forward to it. So we want you to be aware of that now. There's also been a lot of collaboration with the community. So if you have any ideas, if you've been thinking about something like this, you're welcome to reach out to me and we can touch base about what our plans are, what we're doing, and maybe how you can assist if you have ideas about it as well. So I just want to put that out there. As I said, more official advertising will be coming out in the next month. But we want to go ahead and we're going to start emailing people for those who are interested to sign up now. So I'm excited and looking forward to it. So yeah, thank you.
Thanks. So a few other things in the United Way world right now. This coming Friday, we will kick off our Licking County Week of Caring. Right now, we are back up to pre-pandemic numbers. We have 31 service projects that are happening throughout Licking County for an entire week. We have over, I think, 240 volunteers already signed up. This is our first kind of soft rollout, kicking off a volunteer hub. for the entire county. Organizations will be able to go on and regularly throughout the year, tell us what your needs are for volunteerism. And then we will be looking to be that hub to connect volunteers with volunteer opportunities. Some more information about that, I want to encourage you to reach out to Luella Deeds, who is also on our staff. She is our volunteer and outreach director. She'll be glad to get you connected with that. Again, 3 ways that United Way functions to make long-lasting changes: give, advocate, and volunteer. All of those things will help us to increase the services and the opportunities to affect people's lives for the long haul. So reach out and get involved. The other thing that we will be announcing is, again, inviting our community to give to United Way. The only way that we can work on behalf of so many not-for-profits and many who don't have the capacity to do a lot of their own marketing, a lot of their own connecting in a very larger way, is by raising those dollars. Every dollar raised in our community stays in our community. So please consider giving. There it is, John. Welcome, John.
I was just waiting for the ovation. Nobody else gets it when you come early.
We have been killing some time right now.
Yes.
I didn't get the.
Oh, we gotta fix that.
There you go. All right.
Yeah, I'm still used to COVID.
All right. If you're going to transition now, how about that? We've done all of our announcements. We are very pleased today to host the forum on the mental health in Licking County. In 2016, our community, through thousands of people that participated in surveys, focus groups, from key informants to direct recipients, identified 4 areas in behavioral health that were the top priorities for Licking County. Top priorities. Since those days in 2016-17, we've also been through the pandemic, and I would say that those top priorities are probably still top priorities. Our number 1 need addressed in that needs assessment was addiction. Addiction. Our number 2 area was mental health. And we know often when there is a dual diagnosis with addiction and mental health, we often also see things: domestic violence, child abuse and neglect. Those 4 areas make up our behavioral health care priority. We have so many wonderful programs in Licking County and so many people working so hard to address mental health issues. And they will each share with you their own expertise in this area. I will tell you though, again, if I had to do a survey across the county and folks had to say probably what are the 2 top issues that we're continuing to wrestle with, mental health and addiction, I will tell you the other piece of that in our poverty area, that folks cannot address these issues until we start providing adequate basic services, immediate housing, immediate. Not once they've filled out a ton of paperwork, not once they've passed all the checks in the boxes. People have a right to a bed and have a right to food, so that we can then start addressing some of these really complicated issues. So with that, let me just say we want to welcome today our panelists. We have Patty, and they're each going to say a few words about themselves with Southwest Licking Schools. And we have John Jordan, who just graced us with his presence.
Right on time.
From Lab. Right. And we have Colleen Hendon, who is also here with Mental Health America, and Spergel with Mental Health and Recovery of Licking in Knox County. So with that, I'm going to ask them to go ahead, pick up the mic. I'm going to start with you, Kay. If you would go ahead and just introduce yourself and say just a few words of introduction, and then we're going to dive into questions. And again, throughout, please write down your questions because we'll take those at the end. Go ahead, Kay.
So I have to turn this
You have
on.
to turn it on.
Okay. Okay, I can't use microphones. I am sorry. So I'm going to try can everybody hear me?
No.
No,
Really need to use the
I really have to use.
and talk right into it because we're recording this, Kay, so we want to hear you.
Hi, let me just start this again. So my biggest anxiety about this morning is using the microphone. So let's just get this out in the open before we start. I don't do well at this, but I'll do my best. It is such an honor for me to have been asked by United Way to join this wonderful panel this morning and to speak to mental health issues in our community. My name is Kay Spergel. I am the Executive Director of the Mental Health and Recovery Board for Licking and Knox counties. For those of you who don't know what our board is, we are the statutory entity in Ohio that's responsible for assessment of needs, planning, funding, and monitoring and the purchase of service on behalf of both residents of Licking and Knox County, since we have a service district of 2 different counties. By me saying purchasing of services does not mean that we're required to buy everything out of local dollars to have all the money to do it, but we help arrange for it whenever possible. So how many of you are Licking County residents? I want to thank you. You pay my salary. You pay Daniel Kusiak's salary, who's my new clinical director. Your levy dollars, similarly to United Way dollars, make these projects and programs in our county possible. By your generosity and your kindness, that makes a huge difference to the lives of many people that we all touch in this room. So I want to thank you for having me this morning. And I'm going to pass it to Colleen, who I often say that my role in all of this is I write checks. Pretty much is what I do. I write checks. And there are many of you, including the people to my left, who do the really important work day in and day out, boots on the ground, and really are the really heart and soul of what happens in our community. So Colleen, there you go.
Thank you so much, Kay. Good morning, everybody. My name is Colleen Hendon. My pronouns are she, her, and hers. I am the new Executive Director of Mental Health America of Licking County. I keep saying new, but it'll be a year, actually on Halloween, October 31st. Took over for Penny Sittler, which were some pretty big shoes to fill. So just a little bit of background on myself. Unlike the folks on the panel here, I am not a clinician. My background is in public health and health education, and I have a real passion for mental health education. So that's what I kind of bring to the table. Providing some mental health first aid trainings throughout the community. We at Mental Health America Licking County, we really focus on mental health education, prevention, and advocacy. We have about 9 different programs that we provide to Licking County residents free of charge. Some of those programs include our Yes Club, which folks may be familiar with, after school and summer program for youth that has a lot of social emotional learning components to it. We also have our Care program, our Bridges of Poverty. We're really focusing on adults who may be struggling with mental health or need some help in terms of financial literacy. We have a number of other programs as well, which I'm sure I will talk about, but just want to do kind of a quick introduction. And thank you all so much for having me.
Good morning, I am Patty, and it's interesting because I've worked with John, I've spoken to Colleen, we've never met in person, and I've used board funding for things, so I work for a school district at Southwest Licking, and we are, if you just know Watkins or Pataskala, Etna, Kirkersville, we have 6 buildings out that way. We have about 4,700 students. I am a school social worker, but I also coordinate mental health for the district. As far as programs, I don't really have a program because I work for the school, but I do use a lot of the services of the people in this room to connect families to resources. I am always on the search. I am talking to families and students every single day. This is my 5th year in the district, but my 3rd as an actual employee. I was contracted to do outpatient therapy for a few years, but there was a lot of barriers because it's not just the child, right? It's not just the child, it's that environment. It's looking at the whole child, that holistic look. And so there's a lot of barriers just to providing that one-on-one. So I advocated for the district and said, you need to hire me. And they did. And so, and now we have 1 other social workers. We have 4,700 students, and we have 2 social workers for 4,700 students. for 6 buildings and then 1 early learning center. And so, we're very reactive, we're not proactive, and I want to get to the point where we have so many things in place that we are proactive, and we are helping families with these things before they need my support, you know, that they are able to just connect to those. And I'm really excited about being here.
Everybody knows me. Walking in. I do apologize. There was actually related to the topic, a crisis that happened at our agency that kind of pinned me up a little bit. Thank you, Deb, for postponing a little bit and filling some time. I'm John Jordan, I'm Executive Director at LAP, also known as Licking County Alcoholism Prevention Program. For many of you who are not service providers, know us as the drunk camp or drunk driver school. However, we do so much more than that. I think that historically we have specialized and focused only on substance use disorders as an agency. As things transition and we saw the intersectionality of both mental health and addiction, the agency went forward and got accredited for mental health services as well. We do not do severe mental illness treatment. We don't prescribe medications. However, most providers in this room we partner with very well and refer to those sources, referral sources for those services we don't provide. What we do well is specialize in the addiction services, but in order to specialize in this, we have to understand mental health and work with both of them. So that's a big, huge transition. We provide tons of services. We have the only OVI drivers intervention program, the drunk driving school, within 5 counties. We're full every month. We capped it at 16 participants. We used to run them twice a week with 32 participants twice a month. You know, you can do the math on that. With COVID, we had to cut the numbers down. And then staffing, right? Staffing went down for everyone. So there's an unmet need there just for that program. Most of programs around the area weren't successful with keeping them open with the cost of COVID and everything else. We felt that it was crucial to keep that program because everybody drives through Licking County, no matter where they're at. Geographically, we're in the middle of the state. But we provide intensive outpatient treatment, which requires 9 hours of treatment per month or per week. Outpatient treatment, a little bit of case management with the cases that we have. We have a reentry program that's under our umbrella right now. It's the Reentry Coalition with the help of the United Way. They help fund that program to make sure that we have folks that have lived experience that navigate the system who have those barriers with substance use, mental health, or any basic need that they need to be successful in life to reintegrate into society. Board funding is a huge part of how we operate. We do not turn any individual away from our doors who walk up who need help, regardless of the ability to pay. Without those dollars, we wouldn't be able to do it. Another service we provide and we kind of manage for it in MHR is we are the gatekeepers of those funds to get folks into residential treatment if they need it because we don't provide it. So we contract with several different locations to provide that higher level of care for any folks who are struggling in Licking and Knox County. We do a lot of stuff. We try to connect and partner with the schools because we know that service is needed at every level, right? Our youngest client right now, to believe it or not, is 11 years old, severe substance use disorder. We're not really set up for that, but there's no other options. So we make it work. We try to work with them as much as we can. We've had reports that adults who have used methamphetamines at age 6 that walks in our doors. What drives them to use at 6 years old is more than just a choice, right? It's the trauma and mental health that they were exposed to. So that's just a little introduction and cap to start this conversation off on how these two kind of intersect.
All right, you can keep the mic right down there, we'll just kind of go back and forth. I do want to ask all
Nice
of
try.
my speakers, to please put that mic right up there because we want to record this because it's going to be on our website and that way other people can benefit from your experience. I'm going to combine the next two questions for our panelists. So from your experience, what factors contribute the most to overall mental well-being, as well as what are the greatest risks to an individual's mental health? And so you can speak about what are those protective factors, but also what are the risk factors as we talk about mental health, and do both of those together, and then we'll pass that mic down the table. So John, back to you. Speak nice and loud and clear.
So I think obviously housing is a huge risk factor. If somebody who struggles with housing and don't know where they're gonna lay their head at night, they're obviously gonna be stressed, right? How would you feel if you didn't know where to live, where you were gonna live, where you're gonna put your head out at night? How would you feel? Survival mode kicks in. You're gonna do things that you probably would never think of doing just to secure a place to stay. It's trauma. Everything's related to trauma. I really do believe that. It's your experiences in life that mold your perception and how you respond to your environment as a whole in situations. Job, employment. That's huge. Employment and housing. If you don't feel like you can support yourself or your family, have a purpose, you can go down a dark place. There's a lot of individuals saying, hey, I got into the situation because I didn't have a job. Yeah. Well, most people can say, well, just go get another job. You know, jobs are out there. It's not that easy once you get into that place and you don't feel like you have work. You don't feel like you're valuable to have a job at that point. So that's just a little bit that I can speak on that part. Trauma is just a huge factor. And you know, your experiences, your well-being is generational. We know that it's generational. The environment that you're brought in kind of molds that thinking and perception of life in general. So
I think that basic needs, like John said, and Deb was saying earlier, whenever I look at my population, so my population is adolescents, but I have to look at the environment that they're in. I have so many kids that are hungry right now. It is heartbreaking. They need food. They don't have food. We have, I think, close to 50 kids that are coded as homeless right now. So they're couch surfing, or we've had people living in hotels. We've had people living in cars, living at shelters. So the basic needs, are they safe? Do they have a place to live? Do they have food? Do they have water? If we can get that, like Maslow's hierarchy, right? You learned that a long time ago. It's a real thing. Like, let's get that base. Let's get them feeling like they are able to start the day. And so when that is met, I think that they are able to connect with others, and that also means they probably have people in their home or in the environment that they're part of that is supportive people. So when you look at basic needs and they're being met, then that means probably the adults in their life might be able to connect to them and give them that support. So whenever it's like a basic needs also mean that the adults are able to not have toxic stress and connect with the adolescents in their life so that they are feeling loved and valuable, and they're able to connect at school, and they're able to get an education and get a better job and do some of these things. But I think the biggest risk is ACEs, adverse childhood experiences. If you're in this room, you've probably heard about it or you've read about it. We have a generation of people that have undealt with ACEs, raising another generation of people. I see it. Then we have great grandparents and grandparents and great aunts and just a family friend. And we have all these people that are not dealing with the things that they probably need to heal from and need to have addressed. Raising kiddos, and then they do substances and they come to school. You know, there's just it's a cycle that, is not being broken.
So in terms of risk factors, I think Patty and John have really covered, trauma is such a huge risk factor for folks in terms of mental health and addiction. And that could be circumstantial, it could be something that a person is experiencing ongoing, and really trauma is individualized as well. So what's traumatic for one person may not necessarily be traumatic for another, but trauma is such a big piece. A couple of the other pieces I wanted to touch on in terms of protective factors, and I have a real passion for youth mental health. And so one of the biggest protective factors for our youth is actually having at least one adult in their life who they can go to, who's their role model, who they trust, who they feel safe with. And that adult could be any of us here in this room. It's not necessarily always parents, actually it usually isn't parents. It's usually somebody outside the home, or maybe an aunt or an uncle, maybe a coach, maybe a teacher at school, whoever that adult is that youth feels comfortable with, they can connect with, and they feel safe with. Another big protective factor, and I think Patty kind of touched on this a little bit, was in terms of the community involvement. So anytime that we can have our youth be involved with the community in terms of recreational kind of activities are always helpful, and really just across generations. So not just youth, but people in general. We need that community. And being able to connect with other people can be a protective factor. So we have a number of protective factors that can protect us from those risk factors. It's just a matter of kind of realizing what those protective factors are and trying to increase those, especially for our youth in the community who they don't have control over their environment. So I definitely think that focusing on those protective factors with our youth is really important.
So, in support to what my fellow panelists have said, I absolutely agree with everything they've said, and I want to add a couple of other things if I may. So as part of our role as a board, we required every biennium when the state develops a brand new budget to move forward. We just completed one to do what's referred to as a community plan. And in order to do the community plan, we're required to do a very deep, in-depth assessment of community need. And what the community overwhelmingly, including the general population, came out as being the three biggest areas for us to be concerned with. Number one was poverty. And that includes everything we've talked about here. Number two was violence, abuse, and trauma. And number three, that I'm now drawing a blank on, of course. Stigma. Oh, how can I forget stigma? I am so sorry. So for us, taking all those things in consideration, I would suggest one other health disparity, and that's equity. Equity is, do I have equal access to the care, the behavioral health care that I need, or health care in general? Equity is, if I have access to that care, is it the best quality care that I can expect to receive? And that's huge for people. So we know from doing surveying of people, as well as looking at some other statistics, both nationally and statewide, the number one reason people don't seek care is stigma. Followed closely by, I don't think I can afford it. Followed closely by, well, I have insurance, but I can't afford to use my insurance. Yeah. So when you start, and many of us in this room may have the same issue. And so when I think about, when we talk about access to care, equity of services, all these other things that really keep people from feeling fully healthy and well, it's just absolutely amazing. So, I mean, these are the issues I think that we face in our community. I mean, housing is absolutely huge. In our community plan, the three number one things that we identified that we needed to do, one is we really wanted a big crisis center or more enhanced crisis services so people knew how to get better access to care and care that was correct for them. That was one. The second one was housing related to our populations that we serve. And for us right now, that's pretty much supportive housing. And number three, and again, you know, when I get to the last one, the list I'm forgetting. This must be a process of age. What can I say? So as housing that, but it was anything related to access to, oh, it was workforce, I'm sorry. So workforce for us is huge. So our board, so stigma and workforce, so our board funds about 150 different services for both communities. We can offer wonderful care, but if you're afraid to enter that care, those services don't matter. So we have to go back and look at how it is that we make that access to care easier for people and how we begin to address stigma. But the second thing related to workforce is also huge for us. So we can have Colleen and John and everyone else, where service providers provide great services. But if we don't have a counselor, we don't have a social worker, we're gonna have a problem providing services. And what happens then is, even though within our system of care, we'll say, if you can't pay for it, we'll help you pay for it. You'll end up in line waiting to see a counselor, and that delays your care. So what we're doing right now as a board, working with providers, is trying to come up with strategies and ways that we can recruit or retain our most valuable asset at this point, which is workforce. And that is really, really a struggle for many of you sitting in this room who sit in the same boat, because behavioral health care is not the only group that's struggling with workforce right now. But for me, again, that takes it back to equity. So that's how we see, in addition to what everyone else has said up here, some of our major issues.
So hold on to that, Kay.
Okay.
Hold on right there, because it flows right out of what you just said. Through your community plan, you identified the three issues that really need to be addressed. Number 3 is stigma. So let's talk about stigma. And I know that we've been talking about, reducing stigma in our county for decades, right? It gets in the way. Oh my gosh, there's something really wrong with them. We other people who are struggling with mental health. It's not fun to talk about these issues. Shh, don't talk about it, right? Don't talk about it. It's a character flaw, right? And we could go back thousands of generations, the person must be possessed by the devil, right? We've got to get beyond stigma. We have got to talk honestly about these issues. Patty sitting here, and we always would say, right, there's no health without mental health. We all know that. But here it is, 2023. We're still addressing stigma, right? So, what do you think we can do to overcome the stigma in addressing mental health? I'll start with you.
So, Deb, wow. So let me first answer the question this way, and I'm going to date myself. So in the 60s, I remember very clearly growing up in South Euclid, Ohio, a northern suburb of Cleveland. And I remember on our block, we were a very close-knit group of families, and I used to babysit the family down the block. And this was the type of block where you had block parties and family get-togethers, and everybody knew everybody's business, and it was the 60s and blah, 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 blah. To make a very long story short, the mother of the family I babysit for developed breast cancer. Now, you would have thought that we would all have rallied behind this woman and her issues related to breast cancer, and we would have been just as supportive of her as any other time we were supportive of each other, but no, we got radio silence. It was almost as if she had a deadly virus, okay? Almost as if she had a deadly virus. And my mother said, you won't be sitting for her for a long time. And I'll say, well, why, Mom? My mother would get these really hushed tones. Oh dear, we just don't talk about this, but she has cancer. Yeah. And I, as a child, didn't understand that. And if you keep that in mind, and you think now, in 2023, where we were back in the 60s with the stigma that was connected to something now we so much look in our lives as women who develop cancer, develop breast cancer, we celebrate their resiliency, we remember them, we support them in their struggles, we're part of those struggles, right? Yeah. Look how long that took us to get from the 60s to this point today, because even 10, 15 years ago, we're not where we are today. What I think is, number one, we have to live our lives as example, okay? We have to really believe that behavioral health care is every bit as important to our own health and well-being as any other physical health care that you may experience. That's the first thing. We have to believe that ourselves. So when we talk with people, we have to watch our own messaging of how we say things to others. We have to watch our language of how we refer to people that have lived experience. Instead of saying he's an addict, we start saying he's someone who has some addiction issues, right? We have to, it's what I've learned over the years, if I correct someone, it doesn't necessarily go anyplace. But if I learn to watch what I do first, I have to take care of myself first and make sure that I'm doing and saying the right thing. And I'm promoting something that's important. That may go a much longer way. Number two, I think we really, in terms of our advocacy, have to continue to do things legislatively. So we say we have health parity between behavioral health care and physical health care, and that's a law. It really is not that way at all when you start thinking about it. So there's some places that you can continue to advocate for. I also have learned in my experience that when I start using terms like depression and anxiety, everybody heads for the hills, right? I will tell you today, I have seen more people with undiagnosed depression and anxiety from mild to severe than I've ever had in my 45-year career. Part of it is people recovering from what we went through the last 3 years from the COVID epidemic and the trauma they're experiencing, some collective community trauma. Some of it may be related to what's going on in the world today. There are a whole bunch of different things that fit into this. If I start saying, well, you know, you look a little sadder, or you look like you're a little stressed out, those are far more acceptable terms. So part of it is understanding the audience we're speaking to as we begin to educate them. I mean, certainly Colleen and many of my other colleagues are doing a lot in public health education in terms of doing mental health first aid. We do mental health first aid in conjunction with MHA. We also have a brand new program called Encompass, which is coming out of Recovery, Ohio, which is a promising new practice out of the governor's office. And Encompass teaches signs and symptoms of addiction crises for families and tries to teach them language about how to talk to the loved ones as well. So I think there are a lot of resources and things out there we can start using, and we just are going to have to be the champions of this, folks. And we're going to have to keep going out and talking and talking and talking in ways that we can maybe get people to listen. The most impactful thing I have found, particularly teaching mental health first aid, is having a family member come that said, I never knew that I could have a safe place to talk about this. That is huge. We have to give people safe places to talk about this. So there you go.
Thank you so much, Kathy. So kind of piggybacking a little bit off of Kay, I think that a big piece of us helping to eradicate some of the stigma surrounding mental health is changing our language, shifting our language. So as Kay talked about, she talked about that, using that person first language. So rather than calling a person an addict or schizophrenic, we want to more say a person with an addiction or a person living with schizophrenia. We don't want to label people as their diagnoses, because there's much more than that. So if we can take some of the stigma and shame out of those diagnoses, that might be able to help with the conversations a little bit. I think also having more open dialogue about mental health. So whether it's in a forum like this, or even just amongst colleagues, normalizing talking about mental health, I think is really, really big and important. And also for people in leadership positions or just people in the community to be open about their mental health struggles. I myself am a person with lived experience. I was diagnosed with anorexia and was OCD when I was 11 years old, and I have dealt with depression and anxiety throughout my life. So as a person with that experience, I try to bring those experiences to the educational pieces that I provide. And another big piece, I think, in terms of stigma, and maybe not necessarily related to getting folks into mental health care, which actually, no, I take that back, it does. Just in terms of suicide prevention, is such a taboo topic to talk about. Even me saying the word suicide, did anybody shiver a little bit, right? It's just it's a word that we don't talk about, or a topic we don't talk about, but it's really important that we do talk about suicide. And one way that, a tangible way that we can kind of shift our language and be more open and accepting for folks who may be having those thoughts about suicide is how we talk about suicide. So when we say that somebody has died by suicide, we use that big C word, right? That somebody has committed suicide. But what are things that we commit? We commit crimes, we commit sins. So we're already putting that negative connotation and that judgment in the conversation about suicide. So in the suicide prevention world, we want to shift more towards died by suicide. One, it's more medically accurate, right? We don't say that a person committed a heart attack or committed cancer. So a big piece of
That's true.
a big piece of reducing stigma is really paralleling physical and mental health. And I think a big piece, and the topic that has probably some of the most stigma against is suicide. So if we can take some of the shame and stigma out of the conversation around suicide, hopefully we'll have people who aren't going to just sit with that, because oftentimes people who are having thoughts about suicide, they sit with those thoughts in the dark. And what's really important, and is actually suicide prevention, is talking about suicide. So asking the question about suicide can actually be suicide prevention. Sorry, I got a little off topic there, but I just think that suicide is just such a stigmatized topic. We had our suicide prevention candlelight vigil last night. And I know it's hard for folks to come to such an event, but we had pretty low attendance, unfortunately. And it's a topic that we definitely need to talk about in this community.
Colleen, thank you for your courage and sharing some of your own struggles. And I think that her courage is a word that we all need when it comes to reducing stigma. I had put down words matter in person first language, because that's what I'm constantly talking to educators about. But they have both covered that beautifully. But then just her modeling that courage and being vulnerable, I think that we all struggle with. And knowing the forum to share some of those things, because sometimes I talk to adults and they're sharing things with adolescents that they shouldn't share. But I see a little bit of a shift, because I talk to a lot of young parents and high schoolers. And I think that, and I'm gonna use an age here, so if you're gonna judge me, that's okay. But if you are 40 and over, I hear a lot more stigma. And if you are like 35 to 40 and under, the stigma is starting to lift, because people are talking about it more, and it is something that is part of the language and part of the school and part of conversations with people. And I'm not saying that that's a hard fast, but I do see a shift, a generational shift, and probably because of not talking about it. And so people that have dealt with parents that were undiagnosed and they were living in that trauma, now they're able to say like, hey, I dealt with this and nobody helped me. And so I'm willing now to speak out. And so it's not a big shift, but I see a shift, and it's a good shift. And even if it's a 1% change, then every month or 6 months, a 1% change does actually change the trajectory of what that stigma looks like.
Wow. So stigma, we all know that stigma is out there, and it can be very much preventative, just like anything else in here. So coming from an addictions background and treatment, stigma hits us hard, right? Growing up, you would picture somebody who struggled with addiction, living under a bridge, homeless, dirty, not willing to get a job, asking for money on the side of the road, right? That's the stereotype that most people have. Guarantee that a quarter of individuals in this room could have been diagnosed with a substance use disorder within any 12-month period in your lifetime. I remember growing up, going through DARE programs at school. Don't do drugs, right? How'd that work out?
Just say no.
How'd that work out, right? So, obviously, it's not a choice thing. But we always shamed the ones who fell into it. Well, they couldn't say no, right? Not in our favor. Well, unfortunately, it's the populations who don't get the chance to advocate for themselves brought that stigma on. When stigma started hitting other communities and affecting their families, it started bringing attention to the light. We have opioid lawsuits now from members who could do it. You think that person under the bridge had the resources to do so? It's when it affected their families or maybe themselves and took the courage to fight for trying to end it and bringing light to the subject. Addiction's been around forever. Mental health has been around forever. It affects anything that we do. 1 out of 4 individuals struggle with mental health issues. That's a quarter of this room. If I say everybody stand up who knows somebody or themselves struggling with a mental health disorder, 99% of you probably would stand up. And I'll give you one example. We're all individuals in the same world that we have to live together, so we might as well play together. Who has a cell phone? 100%? What happens when you walk out of the house without a cell phone? Anxiety shoots up through the roof. Who remembers the days when we didn't have cell phones? Did you care if you left the house without pulling the phone off the wall? That's how easily it develops. And I just wanted to leave it that everybody can relate to mental illness. And that's one way to really show an example of how we can pass on and say, hey, you know, I understand anxiety. Let me leave without my phone. See what happens. Every time it buzzes, I panic like I forgot something. Things like that. So, I think stigma has been captured prior to me. I just wanted to give a couple examples of how easy it is for us to relate and to remember how we relate to those other folks that are struggling and how we can reach them.
Yeah. I have one thing real quick. Sure, I lived on the east side in our church's house for 8 years, and I had worked in Mental Health America. I know about stigma, but I saw it so much that I was shocked. I would take people to drug court and go in and pay their fines, and they were treated horribly. And I'm thinking they would never talk to me like that. I wouldn't put up with it. I had people that, were getting their electricity turned off, and they would call somebody, and I had, one lady said, the woman said, you must be stupid, you can't do math. And I'm like, who talks to people like that? And I just think that we all, in every circumstance, we need to stick up for people who don't know how to stick up for themselves.
That's right. That's good.
We all united. We have a responsibility to raise our voice for those who cannot raise it.
That's right.
And that's what it means to advocate and to stand in solidarity with others. So true.
I do want to add, I'm sorry. I did say I was done. I know most of the providers in our network and locally do a great job of trying to break down the stigma by partnering with those other agencies and corporations and venues that do not maybe understand. And it might not just be because they don't want to or they want to be stigmatized, and it's just what they know, right? So, for one example, the main place we partner with them for overdose response, funded through MHR, we try to respond to overdose within so many hours after the overdose, or hopefully, the police can call us right away and we'll just show up there to try to provide that support and assistance. We're trying to partner with police departments now and really break down that, because there are some cultures that are set up there that they have a role and that's what they want to stick to, but it goes greater than that, right?
Yeah.
It's the holistic approach. So we're trying to partner with those agencies, those companies, things like that, to really just bring in what we believe, and hopefully it just spreads. You know, they see the payoff.
Can I help you done? So, to piggyback on what John is saying, one thing that I know, and Corey, you sit on this committee, and my friend Ashley sitting in the back sits, and Sylvia pretty much runs it, is we do have a trauma-informed care committee that comes out of Family and Children First Council. And our charge is to determine how is it that we work towards something we refer to as a trauma-informed community. And that means within a trauma-informed community, we begin to address a lot of these more community-based issues about how we treat one another, this whole notion of what does it mean to be kind, but still have appropriate, healthy boundaries with one another, just lots of different things. And so a lot of what we do in our behavioral health care world related to stigma and how people are treated can really be generalized overall to a community response of how are we treating one another? Because if we're not treating each other well, it means we may not be helping well ourselves. I try really hard to remember, this is not always an easy thing to do. If I'm on the other side of a conversation with someone who's not the most pleasant of human beings with me, I try really hard to think about what that person is going through. I will never fully understand what that other human being is going through, ever. But I can develop a sense of humility and humanity and patience and kindness about myself to try to better understand that person's position without letting myself get hurt. And so I think there are some things, and we talk about protective factors of how we teach people about how to function with one another, that we can begin to look at maybe some more collective community messaging together to see how we get to that place. Because I think the four of us up here and the conversation in this room is about stigma is something that's greater than the four of us sitting on this panel and everybody sitting in this room, right?
Yeah. Yep.
So I'm done, I think.
So
So okay, now it's almost a danger now to have a microphone.
hold that microphone.
Your anxiety's gone.
We're recording this for others to watch afterwards. So can't keep that microphone. Keep it right there. Because you have a larger view on what the resources are in our community that address mental health. I'm going to combine 5 and 6 here.
Okay.
What resources or programs then would you recommend to people who are in need of mental health support or services and may not know where to go? And the second part of that is, what gaps in our mental health system are we lacking locally?
So first, let me start this conversation by saying I am very, very grateful for the work that people that are doing this work do. I am so grateful to all your hard work and your commitment to this. That being said, we don't have enough of what we need, and we don't have greater access to that care. So on paper right now, what we have is this. If you are a family that has a child, or if you are a single adult that is in need of addiction or mental health services, there are ways for you to access what we would refer to as the public behavioral health care system. And what we have locally in Lincoln County, for the most part, are what I would refer to as outpatient services. Those are services that are delivered in an office. We also have a lot of different specialized services that occur in county that are outreach services that go out to the community. There are many of you sitting in this room that provide those types of services. We'll get there in a second. We do not have what I would refer to as inpatient care, with the exception of Shepherd Hill Hospital, that provides wonderful care. They really do, where they provide some adult inpatient drug and alcohol treatment services and some adult inpatient mental health psychiatric services. They also do some outpatient services as well. If you are an adult or a child that needs a higher level of care, you're going to have to probably leave this county. And that simply is because, one, to have a program that's a higher level of care, that's a 24/7 program, is incredibly expensive to support, and you need lots and lots of people using that service. in order to break even, to be able to operate and keep your doors open. So most of our programs like that are in Franklin County, and they're very well used. So if you're an adult that goes into addiction crisis, such as what John was talking about, our front door is you call LAP. LAP will do an assessment on you. There's a formal assessment that we have to do. It can be short and sweet and to the point. John and his staff will assist people to getting to the right level of care. I will say one of the barriers that we've got is there may not be a bed available immediately. We work really hard to find the next available bed, the next available service for that individual as much as we can. I will tell you, particularly with addiction, sometimes it's a challenge. We'll find a place for someone to go. And again, they'll turn to us and they'll say, you know what, I don't need this. And they walk away. Fortunately for us, LAB and places like the Main Place and a number of other providers in this community that understand people with addiction will say, okay, so today is not the day. We're gonna go back tomorrow and we're gonna figure out if maybe tomorrow you're ready to do this. All right, so that's key to access to care. Are those of you and others in the community that are very committed to never ending that conversation with that person that's having that addiction issue, and not judging them for it. That's huge too, is not judging people for their illness, because these are brain disorders, these are medical illnesses that people experience. So that's the first thing. If you're experiencing a mental health crisis, people can contact behavioral health care partners. They actually can contact any provider in our system of care, and they will help them get to our crisis services unit and BHP if that's necessary. Those are mobile units. They go out in the community, they go to where people have need, including a large mobile health crisis team that goes out for children. We have an urgent care department that's run by BHP that I never remember the address for, which some of you probably will remember. It's over behind, where is it, John?
It's right on Main Street.
Right
It's on Main Street.
Right next to where Adult Court Services, their building is. It's open during business hours. A person can go in there, a child in the age of 12 and up can go in there, an adult, and if you have any type of behavioral health care need, they will start that process with you. If you need medicine that day, at least for the short term, until you can get in someplace, they're gonna help you, okay? If they're not the right level of care, they're gonna figure out how to get you there. We have Alexa sitting in front of me right now that is really critical to our outreach of both mental health and addiction services. We have others in the community too. So there are lots of different ways to get in. When in doubt, dial 211.
Yes.
Dial 211. These guys work 24/7 and they'll help you figure it out.
Yeah.
We also tell people if all else fails, call us at the board. We also will help direct people to where they need to go. We may send you to 211, but we'll help you figure out stuff. Occasionally, we do have issues that are very complex and very frustrating, and families especially fall right between the cracks, and we know they do. So there's a big collective force of us that try really hard to get people to where they need to be. So let me first start there. It is not a perfect system. Many of you in this room know it is not a perfect system. We still lose people. People don't like their services, and sometimes for really good reasons. We get that. But that's what we have available to you. We also offer lots of prevention services in the schools. We do a lot of overdose prevention through the work of our providers and ourselves. So there are a lot of things going on, and if people want to know more in depth of what some of those programs are, I'd be happy to speak with you when this program's over this morning. If there's other things you're curious about. So that's what we offer. So we know there are gaps in the system. I want to go back to that equity thing. We know there are people that are seeking help in times of crisis because of sometimes their behavior, and that's generally related to the episode of the illness they may be in or what they're experiencing, have issues seeking that out in other places, including emergency departments. Now, I will say, I think LMH does an amazing job with people in a behavioral health crisis that end up at their doorstep. So first, let me say that. But unfortunately, sadly, there are people who end up in jail or are mentally ill, who have addiction crises, and that's where they end up. So we know that we need to get people to places that are safer, where we can start treatment as soon as possible, where we can observe them over time. So we are in the process right now of developing a regional crisis center, which is not going to happen tomorrow. This is a major project for us moving forward. We're very excited about this, and this is being developed just for the reasons I just identified. Most people, when they experience a crisis, don't need to go to a higher level of care. Most people need their boots on the ground, I can talk to you today type of approach. And that helps them plan for their crisis, develop a safety plan, and then move on and get connected with care. But for those folks who really need more support, we need more places to help them with that. I will say that BHP recently received a wonderful grant from CareSource Managed Care, where they have purchased a mobile van. And this mobile van is going to roll around Licking and Knox counties, because we are pretty rural still, providing urgent care services. So when we talk about gaps in services, we recognize at the board that we have communities we're not serving. We focus a lot on our county seats, or places of greater population. We have rural communities farming communities where in culture, traditionally, for many people, it's very hard to ask for help. So we are beginning to work with those populations of people to understand, so what is your perception? What are your needs? There was actually a really excellent series that OSU provided talking about how to work in rural communities of behavioral health care. And I would highly recommend, if you can get your hands on any of those episodes, go watch them. Because these are farm families talking about their issues with suicide, with mental health, with addiction, and what it took to help reach them so they could access care. So does that answer anything I'm missing, guys?
So can I just, do you want to say something about 988?
You know, Debbie, I probably should. All right, so I found this out yesterday. The state's going to be doing a huge campaign in 988 moving forward, and so this will make a little bit more sense to you. It is in federal law that all states will move away from the National Suicide Hotline to go to a new line that's called 988. And the whole notion is, if you're in crisis, particularly if you are in any type of crisis, behavioral health crisis, to dial 988, and they will work with you and try to make connections with you to your local community. In Licking County, our 988 operator is also Pathways, who's our 211 operator. So that'll be a very smooth transition. The whole reason for why this 98 is so critical for our state is, in the 88 counties that are in Ohio, not a lot of them have access to 211s. Or if they do, they have limited access. And so this gives, you can go back to equity, this gives other parts of Ohio greater access to crisis services. So you'll have many numbers to remember. When doubt, you can always dial 211, and they'll do it.
We jumped in there, so we have three numbers. I think everybody already knows 911, right? I mean, if it's an immediate life-threatening thing, don't hesitate. Please call 911. If you want to get directed to thousands of services right here in Licking County and beyond, call 211. If it is a mental health crisis that's not immediate life-threatening, call 988.
With one exception.
Okay.
And 988 will probably take you back to 211. So 211 is our front door to our crisis services, particularly after hours. So it's a direct connection to BHP's emergency services, crisis services, QRT, kids mobile crisis units, those types of things. But because it's one and the same. So anyway, 988 it is. Thank you for reminding me.
You're welcome.
I should remember that. Debbie, is there anything else I'm forgetting I should be talking about?
No, I think we can.
I can pass it down. All right, there you
We've
go.
got a few more questions to go. Yeah.
Thank you so much, Kate. So in terms of some of the gaps that we currently face in mental health services locally, I know Kate covered the majority of them, but just another piece is the cultural humility and identity of our providers, particularly of our mental health providers. Currently, predominantly are like me, right? White folks. And what's really important is that we have people who look like the people within our community, so that people in our community can connect with someone. And sometimes too, when we have, especially youth of color, maybe going to a provider who doesn't have any type of cultural experience or experience with working with Black youth, they may cause more harm than good. So whether they are microaggressions that they may experience during the counseling session, or just straight out racism, can be a huge component. And not saying that that's necessarily happening here, but with the provider pool that we have, we definitely need to recruit more providers of color. And having more of our providers go through some cultural humility training so that they can learn how to better work with and not re-traumatize our folks who do not look like them necessarily. Another piece of that as well is gender affirming or identity affirming care as well. Mental health providers who are supportive of our LGBTQ plus community, especially our LGBTQ plus youth, who may not have that positive kind of environment or support. And oftentimes receive discrimination and hate from the community. So having providers who can create a safe space for our communities, such as our LGBTQ plus community, Black, Indigenous, Hispanic, and other communities of color, is really important. There's Yeah, and in the meantime, just really with our current providers, again, just those cultural, I never like to say cultural competency because I feel like we can never really even truly fully culturally competent. So just some more cultural humility trainings. And oftentimes too, for people of color, they may not reach out. Oftentimes there may be extra layers of stigma, whether that's culturally or generational. So having more providers in our field that understand that as well, and can make folks, family members and folks feel more comfortable going to their session when they have somebody who they can identify with.
Thank you, ladies. I think that they've hit most of those things. I do want to talk to families that have, or talk to specifically families that have school-age children, because that's my population. And so if you have somebody in school age and you are trying to figure out what you need for your child, I would encourage you to reach out to the school and talk to the counselor. In Licking County, there's not a lot of schools that actually have social workers that are working with families. So reach out to the counselor and see what they can connect you with. It is very hard to find resources and supports for adolescents or people that are K through 3. It is really, really, really hard to connect families to somebody that is going to be able to support the family unit and the students to be successful. I am going to do a shout out here for all the foster families and kinship care, which is huge. I work with a lot of those families. And so sometimes I think they're a little bit forgotten in that they have some extra layers and barriers. And so there's an organization called Fostering Further that's here in Licking County. They have a lot of different, they have like it's not a Make-A-Wish, it's like Grant-A-Wish program for kiddos. They have like something in the fall, they have Christmas parties. I think it's fosteringfurtherohio.org. An organization branched off of that is our young adults that have aged out of foster care. There's an organization called Starting Strong. And so startingstrongohio.org, I'm actually sit on the Fostering Further board, and I work with Starting Strong as well. We are trying to help young adults get their driver's license. We have Drive to Thrive. We have an apartment complex. There's 5 units. We work with Bridges. We are really trying to help these young adults be successful. Like we wrap ourselves around them and just kind of help them learn how to adult. And so those are things that a lot of people don't know about. And so reaching out to those foster communities is really important.
So one of the biggest gaps that I've identified in this position is transportation to treatment. That's a huge one. Other than
Preach it,
housing,
preach
transportation
it.
is the second one. We have a lot of rural areas, even though Licking County is not considered rural by whoever makes me so mad. There's still a lot of rural areas outside of Newark that are not getting treatment because they can't afford transportation or have transportation back and forth. We do have an office in Itasca. However, we're capturing a lot of folks from Franklin County in there instead of Licking County, and we're trying to figure that one out. Because it's the ones that are stigmatized out there and don't feel safe to get care where they live, so they drive across the line to us. But our folks that live right around the corner can't even get to our office because they're worried about getting food. And that's a huge gap. It goes back to the basic needs. They can't focus on treatment if they don't have the basic needs met. Yes, kids, they may feel safe at school, but you can't get them to concentrate on schoolwork if they don't know where they're gonna go after school or where they're walking into. So it's really hard for teachers to say, yeah, we got these programs and services, but that's only 6 to 8 hours a day. There's more time at home than in school. That doesn't promote change, but you know, Patty has reached out several times. Other school districts have reached out and identified that as a barrier. So I think the ongoing communication is improving, but that's also a gap, is the holistic view on everything. You know, we're not trying to be superheroes. We can't solve everything, but we all have a role. We just need to work together, and that's it. Just transportation, and we need to collaborate more and partner. I do want to add the LGBTQ plus community. United Way has an affinity group. I'm vice chair, just throwing it out there. I have to throw my United Way hat on for a second. I'm the vice chair for that group. It's every third Thursday. We have a meeting at 6 o'clock down at the United Way office downtown. Feel free to come if you're, ally. Just want to get some information and some competence in that culture. It's out there. I'm okay with that. We're all open to that. The more the merrier to get education. That's the purpose of that group.
Thank you, John. I'm gonna kind of combine also the next two, because I think many of you have already identified some of the gaps that are in our Licking County community. And so that flows right into, how do you envision the future of mental health care in Licking County looking like, going forward? Well, certainly we would like to see more support to fill in those gaps, to provide more services that we don't have. We have wonderful services, but we need more, and there are some that we don't have. So just really in general, if you could share really quickly, and maybe a brief statement, how do you envision the future of mental health in Licking County?
Want me to go first? Do you want to go, John?
Sure. Since you love the mic.
Why don't you go ahead? Go on.
So how I personally envision mental health is that we wouldn't need it and everybody's cured and perfect. However, that's not possible. We all have barriers, and it's okay to have barriers because that strength comes out of that. And bounce back and resiliency. I would love, Kay and MHR, Daniel, everyone's been very supportive and very on top of trying to build that system that we need. I think they're on the right track of bringing that crisis center in. I would love for hospital systems, even on the outskirts, to move in and bring the resources that they have in. They're sitting right there at the New Albany line. They're waiting to inch over. Just go ahead and plant it over here. I envision a behavioral healthcare system be prepared just as much as these corporations are. What I want to preach is really to have strong voice at the table with these corporations moving in, that they're building infrastructure, transportation, things like that. And jobs, jobs and people and population bring issues that we know that a quarter of us struggle with. So that's going to increase. If we're not set up for that, we need to look at behavioral health infrastructure. we're just tackling the issues that we have currently. You know, we try to plan what we see in the future, but we're still addressing things currently on the behavioral health side. So, I envision just to really speed up and really look futuristic on planning, opposed to really evaluating what's past and present. We really have to project that. And so that's just what I envision, just the resources to match up with the growth.
I agree with John. I think that we are very reactive in just about everything that we do. And I can say I'm reactive at my job. I have a list of things I'm supposed to do, but I have a crisis almost every single day. Like a literal evaluation of students for their safety and the safety of others. And I can't get to those proactive things when I'm so reactive to all these crises. And so, and until we address where we are and those gaps, we can't move forward. I would love to see a crisis center in Pataskala, because at least people in Newark can possibly walk to lab. I've got people that don't have transportation, and y'all, they can't go anywhere because transit is really rough in our area. With that said, just being proactive, knowing where we have to be, and working to get there. I made it as brief as possible.
And my answer is going to focus more on just kind of the, even just the stigma surrounding mental health in Hendon County. I think that the younger generation, and Patty touched on this, the 40 and under, but really I think it's Generation Z that's in school right now. Is that the generation that we're?
I don't know.
Well, the generation that's in middle school and high school right now is very open and accepting around mental health. So what I see in terms of stigma, I hope that some of that stigma is going to dissipate with some of our youth that are out there now, who are already mental health advocates, who are doing things in the community, who are doing things on social media to promote mental health. So I am hopeful for our community to be in a less stigma or a stigma-free, well, I don't know if we'll ever be in a stigma-free community, but a less of a stigma kind of community.
Thank you. What a question. So our board's mission is to do both current and future planning. So intel. It kind of strikes fear in my life sometimes when I start thinking about the impacts of what I think about intel. And I commute in from Delaware every morning, and I'm going down Route 161, then I'm beginning to widen, and my journey has gone from, gee, I'm so glad I'm going the opposite direction, everybody coming out of Licking County, to, oh my word, I'm going to get to work in the next hour, which normally was a 20-minute drive. So change is coming. We are trying to get on top of what that change could mean in terms of trying to protect the amount of services, the type of services. I suspect, so the crisis center, I think perhaps some of you may have read in the paper, we just received a $3 million ARPA grant. That only pays for land, guys. And I want you to think about that. That will probably only pay for land and development of that land. So, and this is a huge project. This is not going to happen, like I said, today, tomorrow. It's a future project that we will be working very diligently on. It's VHP's project and their vision. It is part of a bigger state project for us to look as boards how to provide services regionally. Regionally means for us not only Knox County, but it could mean Delaware, it could mean southern Coshocton, Fairfield, the eastern part of Franklin. This is how the state is envisioning services being provided, which is, to John's point, does not take into account any transportation, mind you, but it does take into account how planning is being determined, how funding will follow, and then we're trying to align ourselves with this whole notion. So us moving forward, we're just trying to keep ahead of it and trying to predict what the future is going to bring. In terms of Franklin coming over to Pataskala, it does not surprise me. Franklin is already bottlenecked and not having access to enough services. And we're gonna see more and more of this occur, because I think we're gonna see population, even though it may not happen this very moment. I think we're gonna start seeing some changes in population, and the cultural piece will also change pretty dramatically too. So I think if I were to advise folks, when I tell my board is, I think what we need to do is we think planning is to be flexible and nimble and really open to all sorts of possibilities that are gonna come down the way, while being mindful as to what our mission is. So I think when I think of future planning, that's what I'm thinking of. I will say, I want to go back to this permanent supportive housing thing in the crisis center. I'm getting ready to submit our biannual, what's referred to as a biannual capital plan. Capital plans are plans where behavioral health care providers either request state funding, local matches to purchase buildings, or build new construction for buildings for purposes of programming. 3 of our projects that we would like to put forward to the state are permanent supportive housing projects. Again, we have no idea where we're going to get with this. It will become a much bigger priority of my boards to begin looking at housing and how it impacts the lives of the people that we serve. So that is some planning along with the crisis that we're looking at.
Thank you all. So I'm gonna have this last question, and as we are having them share on this last question, if we can have the staff start collecting any questions that you have. With that, before I go into the last question, I think one of the things that we in many of our circles have been talking about as it relates to so many issues to humans, whether it's, housing, healthcare, is that if we envision a better future, we have got to move from the standpoint of we are reacting to the needs, but we are building healthy humans and communities in a proactive way. How do we move from being a sick care system that responds when people get sick to truly a health care system that is proactive about the health and well-being of humans and communities? I think that's a larger philosophical question, but as much as we want to be proactive about growth and opportunities related to economic development, I really truly think that we need to be proactive about the health and well-being of humans and our communities. So with that, I've got a lot of questions up here. So I'm going to ask you to keep this to one thing, share one thing that everyone in here can do right now to support their own mental health and well-being. One thing.
I have to go first.
Yeah. Okay, one thing.
Give yourself some grace.
Mm.
Be kind to yourself. You can't be kind to anybody else or give anybody else grace until you can do it for yourself first.
That's right. That's good.
Mic drop on that one.
Yeah.
Yeah.
Such a good question and such a good response. Okay.
I was lucky.
Well, I think too, being open about your own mental health struggles, finding someone who you feel safe and comfortable to talk to, because it can be really helpful to be able to talk to somebody, especially if they're judgment free, and you feel safe talking to them. So having somebody who you can vent to or talk to about what you might be going through.
Mine is kind of similar to hers. Whenever I first left my old career and started into this, the person that was doing supervision told me, Patty, make sure you connect to the people that you love.
Mm.
So when I would start to isolate or like things were always on my mind, then I knew that my own mental health was kind of not in a good spot. So whether you have a partner or a spouse or a child or a dog or a cat,
Yeah.
or a best friend, it doesn't matter who that person or animal is, connect to somebody on a personal level and don't isolate.
Going back to what I said earlier, be okay unplugging for a little bit. So I do practice that, I hit silence on my phone, my phone can go off all hours of the night. I silence it. There's only a couple numbers that can ring through. I think Katie's one of them. On emergencies, but if it's not an emergency, she most likely won't be calling me after midnight.
No,
But there are some numbers that will come in for an emergency only, so I'm okay with it not ringing. If it rings, okay, then I have to handle it, but, having all those notifications and all that stuff, silence your phone, be okay with unplugging, and leave the phone home sometime when you get to the grocery store and practice baby steps. It's okay. And then you'll actually see a relief when you're at the grocery store.
Right.
That's the only thing that I can provide that would probably help your mental health.
Right.
All right, we have a stack of questions, so I'm gonna go fast and, try to keep the responses if we can really brief so we get through as many of these as possible. And this is for anybody. What role should the municipal/county government play in reducing housing insecurity?
That's a good one.
Oh,
Yeah. What hole?
oh, no, wait.
Keep it. Hey.
Oh, yeah, okay, so, let's go back to this leading by example. I think for us to begin looking at this issue, it's going to take many different partners at the table. This is a complex issue. Again, it's not gonna go away overnight. One thing that we talk about is taking care of our mental health and well-being. I'm trying really hard not to get myself overwhelmed with some of the suffering and pain I see with people around me, okay? I go back to this grace and kindness thing. So again, this is why my board is beginning to look at what it is that we can do to address our corner of the world, to look at issues relating to housing. And again, as an advocate, I can continue to raise the issue. I can continue to try to plant some seeds. But I do think it's going to take a number of different people at the table to solve the issue. And I think there are different layers to it. Next. Anybody else want to try?
I don't have any.
I'm gonna jump in there.
Yeah.
Just because, again, housing is one of the issues that United Way has been particularly interested in. Right prior to the pandemic, we had partnered with the Newer Development Partners. We had hired 2 consultants to put together a homeless action plan. There were 3 components that were lifted up through multiple community surveys, as well as focus groups and information based on evidence practices and best practices in the area. We brought in consultants who had worked in communities that had effectively eliminated chronic homelessness. Chronic homelessness as compared to homelessness, we will never eliminate homelessness, but chronic homelessness can be addressed. To address housing insecurity, homelessness, we have to do it as Kate says, getting folks to work together is a complicated piece, and we have to address the entire continuum of care at the same time. And we need to start raising voices up around how we receive funding for housing. Currently, we receive funding through the balance of state funding, which lumps us into 9 counties in Ohio. And we're the fastest growing county in Ohio, right now. Those 9 counties predominantly are rural. That adds another additional challenge. We've got to start advocating for available funding that isn't so tied to so many red tape issues and concerns. We need to see more unregulated funding for housing and to loosen those regulations and let the local folks figure out which piece of that continuum is needed and how to get folks to work together. Just an additional thought there. I'm going to jump right into another, I think, emerging issue, not only for our county, but many counties. As the population of older adults continue to grow,
to the point that in the near future, there will be more older adults than young adults. And statistics show this. What is the field of mental health doing to plan for this change right now? Don't all speak at once.
I do adolescents, sorry. I do kids, that's UK.
So, as one of those people that is now considered to be an older adult, you know, I think that's a really good question. I think Colleen was the one, no, it was Patty who suggested that when they, you know, just as a generalization, looking at stigma, who were the ages that were more likely to be more knowledgeable and aware of mental health in their lives and not as apt to engage in any sort of stigma. Our experience and my own personal experience is working with older generations, it's maybe very hard for them to think about their mental health and their wellness because that's not necessarily how they were raised.
Exactly.
They were raised to pick yourself up by the bootstraps. I mean, I can think of my own generation and the generation above me, people that are 80 coming out of the Second World War, myself, I'm a baby boomer. I'm going to age myself, but oh my. So, I mean, how we were raised was we were raised to be strong and resilient, and you never need anybody's help, and you only go to a doctor when you have to, and gee, when you're seeing that specialist, you go into a big urban area, it's all over for you. Okay, and that's really, but we also know with that population of people, there's a significant amount of alcoholism. We also know with that population of people, there also is a significant amount of prescription drug addiction, plus other types of addictive behaviors. It is a group that we really haven't done a whole lot with, and we need to start thinking about what that means. Historically, that group has been served in nursing care facilities, where by law in Ohio, that nursing care facility is to be responsible for their total care, including any of their mental health and addiction care. A lot of us are looking at aging in place for a number of reasons. It could be financial, we don't want to leave our homes, I mean, just whole bunches of reasons. Retirement for many of us has been extended. You know, one of the questions people ask me all the time is, okay, when are you retiring? I go, no, never. So, and it's not because of just fiscal reasons for me, it's because I enjoy what I do and I feel really purposeful and helpful. We just frankly don't have a lot of data about those of us as older adults and how we age and then how we function. So I think it's kind of a new world and about how we're going to plan, but I think we have to begin having those conversations as to what that looks like. And then again, culturally, how do you meet the needs of their population? Because they're going to be very different than younger people. Okay, and we may actually run into more resistance. Just my thoughts.
Yeah.
Thank you. I'm just gonna switch to the next, the other end of the spectrum here. What services are provided for children under the age of 5 who are addressing severe mental health issues?
Okay, so we do actually in the county have quite a few services. They tend to be integrated. They're just not for, they just don't come out of our traditional behavioral health providers. Where is Miss Sylvia? She's still here?
She's right there.
Hi, Sylvia. So, how many of you have heard of Family and Children First Council? Or Children and Family First Council? Okay. They really are our gatekeepers in terms of doing some really significant planning and proposing the programs and staying on the upper front about how to ensure that innovative and really good quality services are available for that population of child. So it really, this is a trite phrase, but it takes a village. So there are lots and lots of different professionals that end up at the table. We actually have a really cool group that's called the Early Childhood Clinical Committee. And their expertise, where is Melanie? Is she here? She's the lady you can talk to about that. Am I right, Melanie? Okay. She knows everything there's possibly to know about early childhood stuff, including a number of other people in this room, and they bring their collective brains together and they help organize cases when they come to them. They provide consultation to providers who are having cases. For real little ones, we don't necessarily hand them a pill and give them counseling. We instead try to look at their environment to see what is it about their environment that we could change and improve so they can thrive and develop. And so we do a lot of parenting programs. Colleen does do parenting programs. You do incredible, which one? You do triple P. You do triple P. Pathways does incredible years. I mean, there may be others in this room as well. So we look at a child very holistically. So there are a lot of services. And if you've ever had any concerns about where you turn for a service that's for a behavioral health need for a child, you can either contact Melanie Fling or you can contact Sylvia and they can help you. Okay?
Another demographic, we've got two questions up here. One person's asking about the United Way affinity group for United and Pride, our LGBTQ affinity group. And that's the fourth Thursday of each month at 6 o'clock, for Thursday. And then a couple of questions about what resources are available at a couple of those fourth LGBTQ affinity groups in Licking County. Resources that specifically deal with mental health, like LGBTQ community.
So the affinity group is in the process. I'm not on that subcommittee. But they're in the process of compiling all the data from local providers, physical and mental health providers that provides affirming care. Okay, that's one thing that we're doing. The other thing, we're having events and trying to push out advocacy of what the purpose of our group is. It's more like just providing a safe space for anyone to walk in the door, regardless of sexual orientation. We do have a picnic coming up as well. You'll see the flyers around. I can't specific, the 24th, Sunday at Rotary Park. There's a flyer. Come out, join us. It'll be a good time. We'll have some games, things like that. It's just a great place for the community to get along together, despite what your gender is, despite what your sexuality is. Human to human, we wouldn't know if we kept our mouth shut, but why should it be fair for the people to keep their mouth shut? We get to say, I'm married to my wife. They should have the same right. That's all we're here to promote, that everybody's equal.
Also, the provider affirming pathways here in Licking County, they are able to provide gender affirming care. They also just started a LGBTQ plus youth support group. Currently, it's all online. We're actually at Mental Health America. We're working on putting together a LGBTQ plus youth support group as well. Out of our Yes Club. Yes Club used to have some support groups, but we're trying to bring those back. But Affirming Pathways is a really great organization here.
Thank you. Got a question about what is the greatest mental health challenge facing our schools and what are the possible solutions? Patty?
How much time do I have? I think the greatest mental health challenge facing our schools is that we don't have enough providers to connect students and families with. We have, and so if we have enough providers that actually accept adolescents, then we would have a lot more people that we could refer to. We do have, in Southwest Licking schools, we do have NIAP. We have 3 providers in the schools, and then we, in order to get private insurance kiddos seen, because that's a huge barrier. And it's unfair to the student that we have, you know, if you have Medicaid funding, we can get somebody to see you. But if you have private insurance, well, obviously you don't have problems because there's nobody that can see you. It's just very frustrating from where I sit. And so we do have an agency, it's based out of Reynoldsburg, and it has somebody that can take private insurance that comes in a couple of days. Well, I think he's 1 day a week right now, but literally runs to several different buildings. Is a caseload of close to 20 kids. And it's just really difficult to get enough providers in the buildings to actually speak to students. The other social worker in the district is sitting over there, and I'm looking at Taylor. Do you agree that that's one of the biggest, you know, a lot of families are actually open for their child to get support. They're looking, they're asking us like, I need help, what can I do? Right now at least at Southwest Looking, our Nepali population has doubled since last year. And it has been a challenge to be able to communicate with those families in a supportive way and explain maybe some of the supports that their family members need, their students need. And so there's just a lot of barriers there, and reaching out to them. A lot of them were in camps, and so they're illiterate in their own language, illiterate in our language. A lot of them don't speak any English, and we do have translators, but just understanding, you know, how to support them is really important as well. But I think just the providers that can come into the schools and stay there. Are you?
Yeah, let me add something. I think Ohio recognizes that's a problem. And so with this new biennium that came out of House Bill 33, the governor created a new state department. And that's the state department is child and youth. And it's taking a lot of the services from a lot of the other state departments, including the Department of Education, the Ohio Department of Mental Health and Addiction Services, JFS, and they're all combining in one department to begin to address needs of children and youth in communities. I think there's a recognition. I mean, we don't have enough money locally to pay for the types of services that all our schools need. We just don't. And so we are very hopeful moving forward that through this new state department, maybe the state will start releasing to schools more resources. We don't know that at this point. We're not sure how this department is going to function, but certainly there are many advocates at a state level that are coming from local places that have made these same concerns that Patty is raising. So we'll have to wait and see.
Yeah, hopefully soon we'll know.
Yeah.
Thank you. Thank you. Thank you. We're going to close up our questions now. And so before we give a big round of applause to all of our panelists here, just a few announcements again. If you have suggestions for future topics, please write those on the green slip on your table, leave those there. We also ask you to put your business card. I think it's something we have a giveaway this time or not. Did Corey not do that? Okay. Next month, come and join us. The second Wednesday of the month, and our topic will be higher education in Licking County. And we'll hear about what's going on in higher education. That's after, you know, the K-12 opportunities that we have in Licking County. Come and join us. Sign up online. Somebody also asked, how do you volunteer? You can go to unitedwaylc.org. And you can find out more information about our community partner council forums. We will have this available that you can share with others. We have opportunities to volunteer, get engaged. Before we leave though, however, I just want to thank our panelists. There is no health without mental health. Thank you for helping our community to help you. Thank you for your expertise. And thank you again, just for everything that you do for our community. So one more. And with that, again, folks, thank all of you so much for taking time out of your schedule.
Like stuff my face now.
Please share what you've learned here with others and invite others to our future talks. Thank you.
When I'm like, can I eat real quick?
So do you have many folks from the Vietnamese community?
We have